Thank you very much. Good afternoon to all. First of all, I would like to congratulate and thanks to Professor Suchita Prabhakar to organize such a wonderful webinar on very important topic on this World Health Day. Now, I would like to come on the very important topic. This is not only beneficial to the patient, but as well as to the entire family. That is known as privacy and confidentiality of health information. Privacy of any patient data is essential because today's all hospitals are NABH accredited hospitals, and during the accreditation process, the privacy of patients' medical record is very much keep in mind by the assessors. Now, let us start. What is privacy and what is confidentiality? The privacy refers to the individual. There are two terms, privacy and confidentiality. The privacy refers to the individual and confidentiality refers to the individual data. For example, the terms privacy and confidentiality is important in the fiduciary relationship. What is fiduciary relationship? A relationship in which one party places special trust, confidence, and reliance in and is influenced by another. Here, the patient and doctors, these are the two important parts of this privacy and confidentiality topic. And the confidentiality, also called confidential relationship, the fiduciary relation between a doctor and patient. The relationship of trust arises when the fair expectation of mutual trust is there between the doctor and his patient. The patient confidentiality regarding his or her treatment of vital importance and should be protected, as it is the right of individual that his or her personal or medical information is kept private or confidential. Such delicate and confidential information about the individual should only be in between him and the doctor, physician, healthcare or healthcare insurance company, or by the court of law. What is the difference between privacy and confidentiality? The privacy apply to the person. The privacy means keeping the medical record restricted or in the world from the public release because it protects the patient identity. If any case, such person medical information reaches the unauthorized third party and the identity of a patient is ascertained to known without the consent of the patient, then such patient can be taken legal action. Whereas confidentiality applies to the data. It refers to the individual right to have personal and detectable medical information which remain private between the patient and the physician. It is an extension of privacy. Confidentiality of the patient is essential element of the personal regard for the patient and also essential certain uplift to the honest and transparent conversation between patient and physician. Divulge information about the patient's treatment is important as it helps the doctors understand the case thoroughly and properly. Medical information of the patient given to a healthcare provider shall not be disclosed to other unless the patient gives his consent to disclose such information to the such information to others. The confidentiality of a part should be maintained because the communication of personal information of records may create personal and professional problem while the patient depend on doctors to keep their medical information private. And there are certain laws are also govern the confidentiality and privacy of the patient. According to the Indian Medical Association Regulations 2002, it has been stated under Chapter 7.4 that the registered medical practitioner shall not disclose any of the secret of the patient that have been acquired in the exercise of his or her professional skill or while conducting the treatment. Chapter 8 states about the consequences of the violation. It explained that if the complaint is made with regard to the professional misconduct of any registered medical professional or practitioner or doctors, or nurses, or compounders, and the same was brought to the medical council for disciplinary action, then upon the receipt of complaint, the appropriate council will hold an inquiry and will also give the opportunity to the registered practitioners to hear the person or by a pleader. Some of the most common sites in medical office include files, folders, and drawers full of important private documents. These documents are essential to the employees who work with patient, but in a physical paper form. They are at risk of damage, loss, or even theft. Without proper document security, a medical practice can violate the patient privacy and lose crucial information. To prevent the unfortunate loss of patient information, it is important to learn securing medical document and how to properly store sensitive patient information. The securing physical storage, keeping document in large file cabinet was necessary to medical industry at one point, but the advancement of computer storage and cyber security called for new methods of document storage. Secure file storage room take up valuable space in a medical facility that people could use for other functions. Secure patient physical paper documents from these common dangers that hinder medical offices. Another important aspect is human error. Even professional misplace important thing. Disorganized workplace and negligence can result in lost document without proper document security, and rules on who can access the data This accident can because commonplace. Adding a checkout and check-in sheet to a storage room may help so long as everyone use it. People could still forget to use it or purposefully avoid it. Another important aspect is document is damage. Accident can happen anywhere, even in the hospital or medical facilities. The more people allowed access to a document, the more likely is to experience critical damage like stain or tears. Furthermore, the physical documents are subject to damage in the event of disaster. While many storage solutions offer sturdy protection from the element and natural phenomena, they are not always foolproof. Extreme disaster may result the loss of documentation. And another is theft and breaches of privacy. The tracking of criminal responsible for a security breach affecting paper document might have to be way more difficult than digital document, as you cannot track the document themselves. If you do not see the crime happen immediately or notice a patient misusing information, you could have to unresolved crime on your hand. Even employees are capable to stealing patient information and using it for their own motivations, such as selling the information for profit and using it to purchase prescriptions. Then the securing a paperless information. Digital documentation are easier to secure if your office make it the efforts to keep them out of hands of hackers. Often security breaches of digitally stored patient information are due to negligence. This happened in renowned institution of India in the past few years. Huge data of such institute was hacked by hacker and ransoms was seized. The digital security in the medical industry has not been a requirement until recently. Digital attacks started to ramp up when they are properly secured and encrypted to your document and will stay safe from cyber predator searching for quick cash or blackmail material. Such incidents was happened recently in renowned Institute of India. Document storage in digital database and format allowed from simple distribution of file between registered users. If corruption during file transfer occurs, it is easy to access a backup or restore from previous files. Digital storage provides the following options of secure and accessible patient documentation. One and most important is cloud storage. Then security to access privileges. This is the another important aspect to prevent the digital documentation. Apart from these, there are various patient rights and responsibilities which already elaborated by previous speaker. The fuse, right and responsibility, the right to have information related to patient medical record kept confidential, and the right to access the patient clinical record. These are the various important rights of the patient. Apart from right of patient, there are various responsibilities are also be there. These responsibility must be followed by patient and their attendant and by us also. The first and important, give as much as information as you can about your present health, past health, illness, allergies, and by other relevant details. Follow the prescribed and agreed treatment plan and comply with the instruction given. Show consideration for rights of other patient and hospital by following the hospital rules concerning patient conduct. आजकल ये बहुत इम्पोर्टेंट और फ्रिक्वेंटली देखा जाता है कि हम चाहे वो पेशेंट के रूप में या पेशेंट के अटेंडेंट के रूप में मोबाइल पर भर्ती के समय भी और पेशेंट को देखने जाते समय भी जोर जोर से बातें करते हैं, जिससे कि नॉट ओनली दूसरे पेशेंट का राइट्स का वायलेशन होता है, बल्कि उसके हेल्थ पे भी बुरी तरह से इम्पैक्ट करता है। एंड मोस्ट इम्पोर्टेंटली हमारा जो नर्सिंग स्टाफ और डॉक्टर्स का स्टाफ है वो भी ड्यूरिंग हेल्थ केयर मोबाइल पर बात करता रहता है, जिससे कि पेशेंट और पेशेंट के जो अटेंडेंट होते हैं उनके हेल्थ पर भी निगेटिवली असर पड़ता है। तो ये हमें अवॉइड करना चाहिए टू कीप मोबाइल विथ अस ड्यूरिंग आवर वर्किंग आवर। इफ इट इज नेसेसरी, allow minimum use of our gadgets. Keep appointment with you make or else notify the hospital as early as possible. If you are unable to do so, do not ask to provide incorrect information or certification. बहुत से पेशेंट कहते हैं कि हमें ये वाला छुट्टी का सर्टिफिकेट बना दो। अभी एक रिसेंटली एक हाईकोर्ट जज ने, एक वकील ने मेडिकल सर्टिफिकेट लगा दिया, डॉक्टर ने इसको प्रिस्क्रिप्शन पर ही लिख दिया था रेस्ट, और वो वकील ने जज के सामने रख दिया। तो जज ने उस डॉक्टर का जो क्लिनिक है वो इमीडिएट इफेक्ट से सील करवा दिया कि भाई आपको प्रिस्क्राइब्ड फॉर्मेट यूज करना चाहिए था। उसको रेस्ट अगर आपको लिखना है तो प्रॉपर आप इन्वेस्टिगेशन करा के और प्रॉपर फॉर्मेट में लिखिए, सर्टिफिकेट के फॉर्म में लिखिए। इसलिए ना तो हमें मांगना चाहिए, पेशेंट को मांगना चाहिए, इनकरेक्ट इंफॉर्मेशन देना चाहिए, और ना ही कोई सर्टिफिकेशन के बारे में उससे बात करना चाहिए। डू नॉट लिटर द हॉस्पिटल। प्लीज यूज गार्बेज बिन in and around hospital. Keep toilet clean after use it. Do not smoke or spill inside the hospital premises. Support the hospital in keeping environment clean. क्योंकि हम सभी जो है वो हमारे राइट्स के बारे में तो डिस्कस करते हैं, रिस्पॉन्सिबिलिटी के बारे में कभी भी हम डिस्कस नहीं करते, चाहे वो पेशेंट हो या पेशेंट के अटेंडेंट हो या हम हमारे हेल्थ केयर वर्कर हो। Maintain silence. Do not bring children below 10 years as visitors. These are the very important rights. On the concluding remark, the privacy and confidentiality in healthcare should be utmost priority, which has to be maintained by doctors, nursing staff, and all other healthcare providers. The doctors and patient relations is based on trust, and it also contains a lot of information or data which should be kept in secret in order to prevent any misuse. The changing environment of every sectors from paperwork to electronic record, it is a very fast pace, and this change from paper to everything online need to protection of data and complete watch in India. Only Indian Medical Council or other council regulations is present while many acts are yet to be mandated in force. These are the some references which was taken into the consideration to prepare these documents before you. Thank you once again. Thanks a lot.